Welcome to the Understanding MACRA Quality Payment Program, Alternative Payment Program Models conference call. My name is Veronica, and I will be your operator for today's call. At this time, all participants are in a listen-only mode. Later, we will conduct a question-and-answer session. During the question-and-answer session, if you have a question, please press star then 1 on your touch-tone phone. I will now turn the call over to Mona Matthews. You may begin.
Good day, and thank you for joining us for the Learning and Action Network webinar, Understanding MACRA Quality Payment Program, Alternative Payment Models. My name is Mona Matthews, and I am a project specialist at Medicare, the Wisconsin organization that is part of the Lake Superior Quality Innovation Network. Our partners in the Lake Superior CLIN are Stratus Health of Minnesota and MPRO of Michigan. The Lake Superior CLIN is part of the Centers for Medicare and Medicaid Services Quality Improvement Organization program. Today's presentation is being recorded, and all participants will be muted during the presentation. We encourage you to submit questions and comments using the chat and sending to all participants. Superior Quinn QIO contact following today's presentation. The names and the contact of these individuals can be found at the end of this slide deck. The PowerPoint for today's presentation was made available to all registrants prior to today's event. I will be your presenter today. Representatives from Minnesota will help monitor the chat for questions. The first objective for today is to provide an overview of the Quality Payment Program. This will be a brief overview and set the stage for the rest of the presentation today. If you would like more information about the Quality Payment Program, you can visit the Lake Superior CLIN website for past presentations. The second objective today is to discover the types of advanced alternative payment models. Understanding Mips APM scoring standard is the third objective for today's presentation. Lastly, I will review the requirements to be an APM qualified participant, or QP. CMS is considering 2017 to be a transition year for the Quality Payment Program. Depending on the track of the Quality Payment Program you choose and the data you submit by March 31st, 2018, your 2019 Medicare payments will be adjusted up, down, or not at all. Practices have the opportunity to select a track. Medicare is calling this Pick Your Pace. Practices and clinicians in the Mips program can submit a minimal amount of data to receive a neutral or small positive payment adjustment. Reporting for 90 days, between 90 days and a full year after January 1st, 2017 will result in a positive payment adjustment. The amount of the payment adjustment will depend on the quality of your data. Lake Superior CLIN has done previous webinars that specifically address the scoring criteria. If you want more information regarding Mips scoring, I would recommend you check out previous presentations or contact your Quinn QIO person. Contact information is listed at the end of this presentation. Most of you are probably already aware that the Medicare Access and CHIP Reauthorization Act of 2015, or MACRA, repealed the Sustainable Growth Rate, or SGR formula, which threatened clinicians participating in Medicare with potential payment cliffs for 13 years. The Quality Payment Program's purpose is to provide new tools and resources to help give your patients the best possible in the highest value care. The program will reform Medicare payment for more than 600,000 clinicians across the country. In addition, it streamlines multiple reporting programs into one merit-based incentive payment system, or Mips. It also provides incentive payments for participation in advanced alternative payment models, or APMs. Clinicians and groups can participate in either the Mips or the advanced APMs. An alternative payment model is an approach developed in partnership with the clinician community that provides added incentives to clinicians to provide high quality and cost-efficient care. APMs can apply to a specific clinical condition, a care episode, or a population. Advanced alternative payment models promote quality over volume by moving away from traditional Medicare Part B fee-for-service. For 2017, there are a limited number of advanced APMs. The list can be found on this slide. Additional APMs may be added, and an updated list can be found on CMS Quality Payment Program website. If you decide to participate in traditional Medicare rather than an advanced APM, then you will participate in the merit-based incentive system, or MIPS, where you can earn a performance-based payment adjustment to your Medicare payments. CMS estimates approximately 500,000 clinicians will be eligible to participate in MIPS in the first year of the program. MACRA replaces 3 Medicare reporting programs with MIPS. These 3 programs that are replaced are Medicare Meaningful Use, the Physician Quality Reporting System, or PQRS, and the Value-Based Modifier, and then they add an additional improvement category to make up MIPS. The 4 categories of MIPS are Quality Improvement Activities, Advancing Care, or ACI, and Cost. In the MIPS program, each of these categories is weighted. Quality is weighted at 60%, Improvement Activities at 15%, and Advancing Care at 25%. The Cost category is weighted at 0 for performance year 2017. There are situations in which these weights may change, including participation in MIPS APMs, which I will review later. Physicians, nurse practitioners, physician assistants, clinical nurse specialists, and certified registered nurse anesthetists are all eligible clinicians. Eligible clinicians are eligible to participate in the MIPS track of the Quality Payment Program if they bill more than $30,000 to Medicare and provide more than 100 care to more than 100 Medicare Part B patients. Clinicians participating in Medicare for their first year are not required to participate in the Quality Payment Program in 2017. In addition, clinicians who significantly participate in an advanced APM are also exempt from MIPS, as are non-patient-facing clinicians with less than 100 face-to-face visits. This slide came from the Minnesota Medical Association and shows the payment adjustments prior to MIPS and what the potential payment adjustments will be post-MIPS. The years denoted on this slide, it's important to note that these years represent payment years, not performance years. The rest of the presentation will focus on alternative payment models. I will begin with a high-level overview of APMs and then discuss the types of APMs. Alternative payment models represent one of the ways to participate in MACRA. There are 2 types of APMs depicted on this slide. The advanced APM has more downside risk. 5 to 8% of providers will participate in the Quality Payment Program through an advanced APM. 92 to 95% of providers will participate by reporting to MIPS, either through a MIPS APM or MIPS. I will be reviewing the criteria for the types of APMs, but first we'll start by giving you some general information about APMs. APMs represent an important step to move the healthcare system from volume-based to value-based. APMs are a payment approach that gives added incentive payments to provide high quality, cost efficient care. They can apply to a specific condition, care episode, or a population. As mentioned before, there are different types of APMs. Advanced APMs are a subset of APMs and let practices earn more for taking on the risks for their patients' outcomes. This slide is an illustration of some of the contents in the previous slide, but it's important to show this, just talk about this for just a minute. It is important to remember that not all APMs are advanced APMs, and it also is important to note that being part of an APM doesn't necessarily mean you won't need to report to Mips. Alternative payment models incentivize quality and value and have both upside and downside risks involved. An APM may offer opportunities for clinicians and groups that are not ready to take the downside risk, which is the downside risk is always associated with the advanced APMs. This slide pertains to advanced APMs. Within an advanced APM, eligible clinicians may be qualifying professionals or partially qualifying or non-qualifying professionals. Clinicians that meet the requirements to be qualifying professionals within an advanced APM will not be subject to Mips payment adjustments, and they will not need to report to Mips. These qualifying participants, or QPs, will receive APM-specific benefits, which includes a 5% lump sum bonus and a higher physician fee schedule update starting in 2026. The advanced APM focuses on quality and efficiency. Some eligible clinicians within an advanced APM may not be considered QPs. I will discuss these criteria in upcoming slides. Eligible clinicians that do not meet the QP criteria are called partially qualifying participants. These clinicians are eligible for special Mips scoring, which lessens the reporting requirements and may render a higher Mips score. With higher Mips scores, they may be eligible for performance bonuses. Each advanced APM has specific benefits as it relates to partially qualifying participants that report to Mips. All APMs focus on quality and efficiency. When it comes to QPs and partial QPs, there are risks and benefits. Qualified participants in an advanced APM have upside and downside pay for performance. In addition, qualified participants do not need to report to Mips. They report through their APM. As I already mentioned, QPs in an advanced APM will receive a 5% bonus payment and higher fee schedule starting in 2026. Partial QPs share some of the same benefits as QPs. They have the option to report Mips and receive Mips payment adjustments and have special scoring standards specific to their APM. Exceptional performance bonuses can be received if the Mips score is above 70. Again, that specific Mips scoring, LSQIM did do a presentation if you want some specifics about that. Currently, MACRA defines alternative payment models as one of these four things on this slide. An APM could be a CMS Innovation Center model, Medicare Shared Savings Programs, demonstrations under the Healthcare Quality Demonstration Program, and demonstrations required by federal law make up all the different types of alternative payment models. This next section that I'm going to go through, I'm going to talk a little bit more in more detail about advanced APMs. All advanced APMs must meet the requirements listed here on this slide. The APM must require participants to use certified EHR technology, and the APM must provide for payment for covered professional services based on quality measures comparable to those in the quality performance category under Mips. The third criteria is the APM must be either require the APM entity to be a medical home model, expanded under CMS Innovation Center authority, or bear risk for monetary losses of more than a nominal amount under the APM. More detail will be provided on each of these criteria in the slides that follow. To meet the first criteria, that requires the use of EHR technology, at least 50% of the clinicians in each APM are required to use certified EHR technology to document and communicate clinical care information with patients and other health professionals in their group. The shared savings programs requires that clinicians report at the group level or TIN level according to Mips Advancing Care, so that would be pulled out. To continue for the criteria for an advanced APM and expand on the Mips comparable quality measures, the quality measures to determine payment must be evidence-based, reliable, and valid. And just like in Mips, at least one of these measures must be an outcome measure if there is at least one applicable measure available in the Mips list. This third criteria requires APM entities to be a medical home expanded under the Innovation Center authority or requires participants to bear more than a nominal financial risk for losses. The final rule with comment period defined the risk requirement for advanced APM to be in terms of either total Medicare expenditure or participating organizations' Medicare revenue. To further explain that with the nominal risk, the financial risk may be met by withholding or reducing payments or require direct payments by the APM entity to CMS. So advanced APMs, this is a list of the advanced APMs for 2017. Many of these advanced APMs are also Mips APMs, which you will hear more about later in the presentation. There are two steps to earn a 5% advanced APM incentive in 2019. The first, the entity must meet both the criteria at the advanced APM level in 2017. An entity may comprise of multiple TINs. First, the entity must meet the billing threshold during 2017 performance year. The threshold can be met in two different ways. The first, by meeting Medicare Part B physician fee service dollar threshold, which is 25% of the entity's Medicare Part B physician fee service, or patient volume, which is 20% of the 2017 Medicare Part B physician fee services. Just to note on this slide, the first note that's on the bottom, the first asterisk down there, should read, if your advanced APM entity hasn't met these thresholds, you may need to submit Mips data to avoid downward payments. So this is at the APM entity level, needs to meet these. I'm going to move on to qualified participants at this point. APMs so QPs that are eligible.
Mona, can I back you up on slide, please?
Yeah, that would be great. Go ahead, Lisa. This slide?
Yes, thank you. So I want to do a correction on if your advanced APM has not met those thresholds, you may need to submit, you have the choice to submit Mips data to accept the Mips APM payment adjustment. For those in advanced APMs who have not met those thresholds, you have the choice of submitting to Mips.
Thank you, Lisa, for that clarification.
Thank you.
Are there any other questions in the chat that we should address before I move on to the next section?
None at this time.
Okay, thanks, Lisa. So I'm going to talk a little bit about the QP requirements. QPs are eligible clinicians in an advanced APM who have a certain percentage of their patients or payments through that advanced APM. QPs are excluded from Mips and receive a 5% incentive payment for the payment year of 2019. For 2017 performance year, the percentage of payments is 25%, and for the patients, it's 20%. This will stay the same for 2018, but as you can see in this slide, it significantly changes starting in the year 2019 and beyond. The two methods for calculating the payment and patient thresholds can be found on this slide. The payment method will take the dollars for the Part B professional services to the attributed beneficiaries and divide the dollars for the Part B professional services to the attribution eligible beneficiaries. The patient count method will do a similar calculation, but will use the number of patients. Remember that clinicians must meet the payment or the patient counts to be considered a QP. They do not have to meet both these. It's one or the other. CMS will calculate a threshold score for each advanced APM entity's payment amount and patient count. As mentioned before, the threshold score is based on Medicare Part B professional services and the APM's attributed beneficiaries. CMS will use the method that results in the more favorable QP determination. These are the snapshot dates that CMS will use for eligible clinicians to be on the APM participation list. An eligible clinician will need to be on the APM's participation list on at least one of these 3 dates during the performance period. That would be for this year. That's from starting January 2017. If a clinician is not on the APM's participation list for one of these 3 dates, then they may need to report under standard Mips. This slide describes things in a bit more detail of how the QP determination is made during the performance period. For each of the 3 QP determinations, CMS will use claims from period A for the APM entity participants captured in the snapshot at point B. CMS then allows for claim runouts during period C and finalizes determinations at point D. If an APM entity meets the QP threshold, subsequent eligible clinician additions to the participation list it does not mean they automatically receive QP status at that time. If the group meets the QP threshold for subsequent QP determinations, then the new additions become QPs. To explain this just a little bit further and to clarify this based on some explanations that we've received from CMS, I think it's important to note that this slide refers to the APM entity. And remember that APM entities could be made up of multiple PINs. Organizations will work with their APM and provide a list of providers associated with that APM. If the APM entity meets the 25% payments or 20% patient criteria discussed earlier, then all the clinicians on the participation list are considered to be QPs. I'm going to stop there for just a minute and just check in with Lisa to make sure there's nothing more to add on that. Being one of our experts on this.
No, I think you've stated that pretty clearly as it can be stated.
Yeah, because there's,
please add.
Yeah, because there is some confusion on this, the QP status at the level of the QP or at the level of the entity. So hopefully that helps to describe that a little bit better. So some people, you may prefer to look at this as a picture on how eligible clinicians become QPs. Eligible clinicians within an advanced APM entity that does not meet the threshold scores are not QPs. And those that do meet the threshold scores are considered to be QPs and will not need to report to Mips. It's important to note that if you have qualified professionals are exempt from Mips and will be scored through their APM. In the next few slides, I'm going to describe Mips APMs. So just to check in, make sure there's nothing in the chat about advanced APMs before I move on to the topic of Mips APMs. Nothing in the chat?
You're good to go, Mona.
Okay, thank you. Like advanced APMs, Mips APMs are a subset of APMs. Some APMs will not meet the requirements to be an advanced APM. Eligible clinicians in these APMs will be subject to Mips reporting requirements and the Mips payment adjustments. In addition, eligible clinicians who are in an advanced APM that does not meet participation thresholds to be a QP, they are to be excluded from Mips, or you don't have the QPs in there for the year, will be subject to Mips APM scoring standard. I think I've said this before, most alternative payment models are also Mips APMs. The benefits of being part of a Mips APM are that you have a reduced burden. The scoring under APM scoring standard reduces some of the reporting. And all of them focus on goals and objectives of the APM entity. All eligible clinicians within a Mips APM receive the same Mips score and subsequently the same payment adjustment. Mips eligible clinicians who participate in Mips APMs will be scored using the APM scoring standard instead of the generally applicable Mips scoring standard. At the beginning of the presentation, I said that there are times that the scoring standard is changed, and one of them are these Mips scoring standards. During this presentation today, there's not enough time to review each of the APMs and the scoring standards, or whether a particular APM is a Mips APM under the scoring standards. CMS has put out several documents to help you evaluate individual APMs. If you need assistance locating that information, your ClinQIO contact can assist you with finding that information, as can your APM entity. Eligible clinicians receive additional scores in the improvement activities as part of a Mips APM. It is also important to note that most advanced APMs, as I mentioned before, are also Mips APMs, which allow those that do not meet QP status within an advanced APM to be scored under Mips according to the APM scoring standard. There are some specific requirements for Mips APMs. The APM entity's participant participate in the APM under an agreement with CMS. The entity must include one or more MIPS-eligible clinician on the participation list and base payment incentives on performance, either at the APM entity or the eligible clinician level, on cost and utilization and quality. The snapshot dates to be considered part of the APM entity for the APM scoring standards are the same as those used in the advanced APM. Eligible clinicians must be on the APM participation list on one of these 3 dates. If they are not on the participation list, the eligible clinician will need to report under the standard MIPS scoring. So if you have a MIPS APM and you have a clinician that joins after August 31st, they would need to report to MIPS. Do we have a question? Oh, the next 2 slides have a list of the MIPS APMs that qualify for APM scoring in 2017. It is important to note that this list was complete when the slide was developed. However, there may be some additions. Again, I'm going to refer you to the CMS website so that you get an up-to-date list of the APMs. And again, if you have difficulty finding these resources, please contact your Quinn QIO representative for some assistance. The next section that I'm going to talk about is kind of the future of the APMs. So CMS stated its intent to broaden opportunities for clinicians to participate in advanced APMs. CMS's goal is to get people away from fee-for-service and participating in these alternative payment models. They're doing this by retrofitting existing models to qualify as advanced APMs. They're also using the CMS Innovation Center to create new models, including those recommended by the Physician-Focused Payment Model Technical Advisory Committee, which is a long name. They're shortening that to the PTAC, which I'll talk about in a little more detail next. Looking ahead to performance year 2018, CMS plans to increase the number of clinicians participating in advanced APMs. CMS anticipates reopening applications for new practices and payers in the CPC Plus, and they do also look to have more participants in the next gen ACO model in 2018. So as mentioned before, one mechanism that CMS is using to evaluate future APMs is this Physician-Focused Payment Model Technical Advisory Committee, or PTAC. The PTAC is an important avenue for the creation of innovative models and was created by MACRA. Just a little specifics about PTAC. It is an 11-member independent advisory committee to the HHS Secretary. The PTAC will review stakeholders, proposed physician-focused payment models, and make recommendations to the Secretary regarding whether the models meet criteria established by the Secretary. So where can you go to learn more about these? CMS has organizations in each state that can provide help to clinicians who are eligible for the QPT. If you need assistance, a good place to start is with your contacts from the Quinn QIOs. So Lake Superior has the role of offering some education, some technical assistance, and physician-eligible clinician engagement and beneficiary engagement. And you can contact the folks that are on this slide for those, for more information on that. This is my contact information. And we have some time for some questions. Do we have any questions in the chat?
No questions in the chat at this time, Mona.
Okay. Can we get instructions as how to ask a question from Jennifer? Can you announce how to ask a question?
If you have a question, please press star then 1 on your touch-tone phone. If you wish to be removed from the queue, please press the pound sign or the hash key. There will be a delay before the first question is announced. If you are using a speakerphone, you will need to pick up the handset first before pressing the numbers. Once again, if you have a question, please press star then 1 on your touch-tone phone. Standing by for questions. And we have no audio questions at this time.
Wow. Okay. Either we've totally confused everyone or everyone's understanding this information.
So this is Lisa from Lake Superior, QAN. And so I want to just kind of, as you went through this slide, there's a lot of words and verbiage from CMS that talks about participating and qualifying participants and partial qualifying participants. As we understand today, those who are qualifying participants are in an advanced APM and have met the threshold. If they do not meet the threshold, they are a partially qualifying participant, and thus then qualify for the Mips APM scoring standard, and those partial qualifying participants will be at the advanced APM entity level across multiple TINs within that advanced APM. I just want to clarify that. It's been a point of confusion, and as we understand it today, that's what CMS is telling us, is that the QP participant status is assigned at the entity level, and that can be across many organizations and even states, depending on your contract with your advanced APM. So those, and Mona, I'm going to have you back up to those Mips APMs. It's a slide that shows in different colors the Mips APMs. I'm just taking up time here because I want to have you help understand.
Yeah, and I appreciate this because it can be kind of confusing. I think I went past it, Lisa.
I think in the past, so it's the second, I think it's in slide 40s, something of that.
Okay.
Right here, starting here.
Right here. Yep.
So if you can see on this slide, the Medicare Shared Savings Program's Track 1 is an advanced APM. So Tracks 2 and 3 of Medicare Shared Savings Program are not advanced APMs, but they, along with Track 1, 2, and 3, all qualify for the Mips APM standard. If you're just in Track 2 and 3, you aren't even going to be in the advanced APM track. You're going to be Mips APM. But if you're in MSSP Track 1 and you don't meet the qualifying criteria to be in that advanced APM qualified participant, and your entity as a large falls below those numbers, then your MSSP Track 1s would use the Mips APM scoring standard. So they're kind of both. The MSSP Track 1 could be advanced APM or Mips APM scoring standard. Tracks 2 and 3 are only eligible for Mips APM scoring.
Thank you, Lisa.
Sure, and then the next
that's a good example. Yeah.
Yeah.
Go ahead.
The back one slide again.
Okay.
The next generation ACO model generally would be an advanced APM, but if they don't meet the criteria, I do think in the next generation that everybody in a next generation is going to be if you're on the list, you're in the advanced APM model. But let's say there is some reason that you fall below that model. There is a Mips APM scoring standard that you can use if you fall below the billing thresholds. And if you look at the third one, the comprehensive ESRD care, only those with two-sided arrangements are advanced APMs. Those with one-sided arrangements can use the Mips scoring standards.
Great. And this is Reed at Stratus Health, Lisa's colleague here and part of the LSQIN. And this is indeed a tricky thing, so I just want to confirm our wording on this. Lisa, the MSSP Track 1 is an alternative payment model, not an advanced payment model, correct?
The MSSP Track 1 has up and down sides, has two-sided risk, so they are an advanced APM. But they can also qualify for Mips APM scoring standard.
And there's also some information that's not contained on the slide here, which is kind of future. So in the future, there'll be a Track 1 Plus, which would be an advanced APM. And we may need to take that offline. Don't mean to contradict any information here, but we have a couple people in the room that, because it is a tricky subject, we're thinking that the Track 1 was an alternative payment model, just a straight APM, not an advanced APM, with the Tracks 2 and 3 having an upside-downside payment model, which would make them an advanced APM, whereas Track 1 is only upside without the downside payment, leaving them as...
I'm sorry. I did mix those up. Yes, you're correct. Thank you for bringing that to my attention.
Yeah.
Tracks 2 and 3 have the up and down side, and Track 1 does not.
Right.
No worries, a lot of detail here.
Yeah, so really if you're looking at this slide, the blue text are those APMs that are advanced APMs, but would also qualify if you have clinicians that are not on the APM qualified participant list, they would be reporting as a Mips APM.
Yes, the blue ones are advanced APMs, and if they don't meet the criteria, they'd use the Mips APM as partial QPs.
Right. Okay. So the same thing with this next slide.
Correct.
So that is the significance of the different colors. Are there any questions with that in the chat? You guys see any?
No, I don't see any questions.
Okay. All right. Anything else to add from the Stratus group?
Yeah, I was going to add, this is Reed at Stratus, barring some audience questions here, I was thinking, what does it mean for a Mips participant to kind of progress into these models? Maybe we can talk about that for a minute or two, and how do I kind of onboard and move through the progression to become a participant in an alternative payment model or move up to the advanced alternative payment model and have that different scoring method applied to me or be exempt from the Mips scoring?
Well, one of the avenues that they're developing more advanced alternative payment models and some of that avenue, but are you asking about specific eligible clinicians, Reed?
So I was kind of throwing the question out there, and I can kind of self-answer it a little bit here, is that, a lot of us are participating in the Track 1, the majority aren't in Track 2 or 3, the advanced APM models. So that's one way to onboard if you're a Mips clinician and participate in that type of model. And then also the progression that CMS is taking to bring some upside downside, so those that are in Track 1 can easily move into the Track 1 Plus and then become, in later years, I believe it's 2018, they're going to consider the Track 1 Plus as kind of both that upside downside advanced alternative payment model. So there is kind of a progression there, and as you take more risk on, you can progress into that Track 2 and 3, and I know there's kind of some sign-up and participation timelines and so forth, but the concept is moving to a progressively higher level of risk, both the upside and downside. So you're rewarded for taking on more risk. So any comments or thoughts on that, Mona or Lisa?
I think my answer to that is that there are many avenues to begin to play with how it feels to be in an advanced APM, and one of them is the Transforming Clinical Practice Initiative. And if anyone is interested in learning more about becoming part of the TCPI through a practice transformation network, they really gear your practice towards how to become prepared for value-based care settings.
Yeah, and one thing I might add to that is if you kind of look at, how do I progress into one of these models? If you look at what the requirements are for the individual categories in Mips, the quality, the improvement activities, advancing care information, and eventually cost, a lot of what you're doing there is the foundation and basis for participating in an APM. So CMS is kind of structuring and setting up sort of this escalator to progressing to those models. So it's not like all of a sudden you're moving into something entirely different. You're moving into something that's more familiar, but again, just taking on that financial risk and reward.
Good point. Anything else to add? Do we have any questions from the audience?
Once again, if you have a question, please press star then 1 on your touch-tone phone. And there are no questions at this time.
All right. There's nothing further as far as questions or anything in the chat. We can close out a little early today.
It looks like we have a quiet group today, Mona, so let's give them
I know, I'm stunned. I thought there'd be more questions out there on the APMs. So, but I would encourage you, if you do have questions after the presentation or specific questions about your APM, you can contact your APM contractor. We'll have the APM specific things. But if you have questions about the quality payment program in general, reach out to the people that are listed here on this slide. We're happy to help. Okay. Given that, with no questions, we'll close out for today. And I thank you for all attending.
Thank you, Mona.
Thank you. Bye.
Thank you, ladies and gentlemen. This concludes today's conference. Thank you for participating. You may now disconnect.